Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027. Or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. Callers, and not necessarily those of this station, its staff, management, or sponsors. AMP2.TV presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome, my friends in South Florida and all over the country. This is your host tonight, Lou Biazzi. We got a fantastic guest on tonight, a very great specialty. We're lucky to have him. He just came to South Florida. We have a guest, Stephen A. Plato, MD and a thoracic surgeon. Steve, are you around? Dr. Plato, are you around?
Yeah, I'm on the phone here, Lou.
All right, Doc. We expect to see you on camera, but since you're on the phone, we got a few questions. Doc, you know, you've been in the area how long?
You know, I started here in September.
In September. And I tell you, we're very, very lucky to have him. He's a young man, brilliant young man, and he specializes in cardiothoracic surgery. What is cardiothoracic surgery, Doc?
Well, cardiothoracic surgery is a pretty broad term. Really, it encompasses anyone who does surgery in anything in the chest. So that's lung surgery, esophagus surgery, heart surgery, and there's a special group of doctors who do congenital defects in children, so heart surgery in children. All of us are cardiothoracic surgeons.
Okay, you studied. Where did you study basically, and where did you got your specialty? You spent many years at the university, many years getting your specialty. What's some of your background as far as where you studied and what you do before you came to South Florida?
Yeah, I grew up in Michigan, so I started out my undergraduate college there and did medical school there as well, and found my way to Cleveland for 5 years of residency. Most people do general surgery. I did vascular surgery, so blood vessel surgery. After that, I spent the last several years in Loma Linda, California, doing, a specialty training in cardiothoracic surgery, kind of focused on adult heart surgery.
Doc, who would be basically a patient? What type of patient would come to you for this type of surgery? Anybody that's suffering from cardio problems or upper chest problems?
That's correct, yeah. So we see a lot of patients that have lung cancer, esophageal cancer, have problems with their heart function, either heart valve or coronary artery disease. Maybe they've had a heart attack. We also see a lot of patients that have had aortic aneurysms, which is a dilation or an enlargement of the aorta, which is the biggest blood vessel in your body, or an injury to the aorta. We'll see those patients as well.
And there's a system of surgery that's called TAVR. Am I pronouncing it right, TAVR?
Yeah, it's TEVAR.
TAVR.
Yeah.
What type of surgery is that, Doc?
Yeah, so TEVAR is kind of a specialized, we call it an endovascular surgery. So what that is endovascular, inside the blood vessels. So what we can do is put a new heart valve inside of the heart by going in through the artery in the leg. So instead of a traditional open heart surgery where we make a big incision through the chest, we're able to actually kind of sneak in through the artery in the groin and get all the way up into the heart and put a new valve in. And that's called TAVR, T-A-V-R, transaortic valve replacement.
You know, you hear so much about heart disease and other diseases, esophageal cancer. A friend of mine did suffer from esophageal cancer. Now, what are some of the causes of that esophageal cancer?
The traditional things we think of are acid exposure, so people that have had acid reflux for many, many years. That's one of the things we think of.
So anyone that was suffering from like acid reflux and they were on medication, like for instance, they take this Zantac or whatever that may be to stop it?
Yes. Yep. And typically patients that have had those problems for many years, and we can see some changes in the esophagus that eventually turns into cancer. So we do see that sometimes.
And how's the life expectancy for that when you have it?
Esophageal cancer is a very difficult problem. Typically we treat these patients with chemotherapy and radiation and sometimes surgery. Life expectancy typically isn't, as good as we would like to see.
I had a friend who had it, and he suffered, and he went through all the surgery, and he survived. He's been surviving with this for a tremendous amount of years, and he came out of it. He's one of the few that came out of it. That's fantastic.
That's outstanding. Very good.
Yeah. Now, what hospitals do you have basically privileges at?
I spend the vast majority of my time at Florida Medical Center, which is a Tenet healthcare facility. It's on Oakland Park Boulevard by the Turnpike. I also have privileges up at Delray Medical Center.
At Delray Medical, too. That's fantastic. So if you folks are living in Fort Lauderdale, he has access to Florida Medical Center, which is a renowned hospital, heart hospital, and Delray, which has just put a tremendous amount of money into their facility. So he serviced anybody in Delray and Palm Beach. His name, remember, Dr. Plato. So if you're having any cardiovascular problems, you should probably look him up. What number can they reach you at, Doc?
Yeah, the best way is just to call my office directly. It's 954-739-2273.
Now, if a person is suffering from cardio problems, any heart disease or basically any type of blockage, what are some of the things that he should be looking out for before he sees you?
Yeah, honestly, most of the patients that I meet don't come to my office directly. They come either through the emergency room because they've had trouble breathing or shortness of breath or chest pains, or they've been followed up by their cardiologist or their primary doc, and they've found a problem, with the heart function or the heart valve, and that's how they end up in my office. So the things I would really think about, though, are chest pain, primarily chest pain or trouble breathing would be the things that often bring our patients to the emergency room.
So any patient, like for instance, a patient that has AFib, which is very well, basically a lot of people have AFib today.
Yeah.
Now, an AFib, that could lead to other diseases. Would you be dealing with local cardiologists? And a lot of your referrals come from the local cardiologist when they feel surgery is necessary, especially
That's correct.
Usually at Tenet Hospital. I know I deal with a Dr. Fafai at Tenet Hospital. You probably know him. Dr. Fafai?
Oh, yeah.
Yeah. Now, let me ask.
But
Well, you should meet him. He's a fantastic young man. He's a Harvard grad. So look him up. Dr. Fafai, he's part of the Tenet group at the hospital there. And he's a young man, great young man as far as the cardiologist goes. And I know people have been using him. And we at All County Healthcare, we have a number of cardiologists who do send referrals to us for, especially for rehab. Now, if a person has this surgery done to him, what is the expected time for, say, get back to somewhat normal life?
Yeah, so I always tell my patients I kind of expect them to be in the hospital with us for 3 to 5 days. And then they'll go home or go to rehab. A lot of patients go home. And, things aren't totally back to normal for about 2 months. And that's because, especially when we make that incision through the breastbone, we want to give them a fair amount of time to heal, so about 2 months to let that bone heal solid.
That's amazing. So when he has this type of surgery, he can go home, he can even get home care at home, correct, Doc, which has rehab? Can be rehabbed with home care.
Commonly.
That's where All County comes in, I hope. So I appreciate that.
Awesome, yeah.
I'm
Yes,
doing a
sir.
little plug for us too, Doc. So the answer is,
Yeah, good.
so he basically goes home to rehab, or he goes to a rehab center, then eventually goes home, has more rehab, and only within 3 months he's back almost to normal. Is that correct?
Yeah, yeah,
That-
absolutely.
That's amazing. It only takes 3 months after that type of surgery.
Yeah.
Well, let me ask you a couple of more questions. When this thoracic surgery happens, when you need to do thoracic surgery, is it usually found in an early stage, or is it just comes about? Could it be coming from a heart attack? And let me ask you, what's the thing about the aortas? You know, a lot of times they give you a
Yeah.
test of the aortas.
Yeah.
Am I saying that
aorta is
right?
The biggest blood vessel. Yeah, aorta. Yeah, you got it. Aorta is the biggest blood vessel in the body. It connects to the heart, and that's where all the blood goes from the heart to the rest of the body. Comes straight up towards your neck, gives off some blood vessels called the carotid arteries that go to your brain, and some vessels to the arms, and then makes a sharp U-turn and goes down and gives off all the blood vessels to the rest of the abdomen and then the leg.
So
The thing we see with the aorta is that over time it dilates, and that's a pretty normal process. In some people, it dilates even more, and it can be a major problem, and it can even rupture. And if it ruptures, people don't do very well. About half of those patients don't even make it to the hospital. They don't survive.
oh my God.
So we like to identify them early, and that's maybe where you've heard of an aortic scan, and then fix them before they get that big.
What are some of the root causes of the coronary artery blockage and the types of heart ailments you provide to care for?
Yeah, that's a great question, and it's something that's very prevalent, coronary disease. And the primary cause is buildup of plaque in the arteries. We know things that make that more frequent or affect it are family history and smoking history and diabetes. Those are the primary risk factors.
Doc, I think we're going to take about a 30-second break, a 60-second break. We'll be right back with you. So let's hold on, and I got some more questions to ask you. So far, you've been a wealth of information. And again, let's take that 30-second break, please.
Hi, my name is Deanna Barron. I'm an RN with All County Healthcare. I used to work for this huge corporate-owned home health agency, and I was always worried that they wouldn't let me make enough nursing visits to be sure that your wound was fully healed, or that you were completely comfortable checking your husband's blood sugar level and giving him the correct dose of insulin, or that your mom's lingering cough was the end of her bronchitis, not the beginning of a new episode. The owner of All County Healthcare always says, give the patient what they need, and he means it. At All County Healthcare, I see my patients until their goals are met, and I never worry. I hope you never need a nurse to come to your home, but if you do, tell your doctor, I want All County Healthcare.
You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask, but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back, and welcome back, Dr. Plato. Again, Dr. Plato's phone number, if I'm saying it correct, Doc, it's 954-739-2273. If you suspect that you're having any problems with your heart or your heart condition or your carotid arteries, Doc, and also that thing around the neck, what is that called, Doc, when they do they do a test on your neck? What are those arteries?
That you said it already, the carotid arteries.
The carotid arteries, right. So they do that test, and that's one of the causes. So if you think you're suffering, you have trouble breathing, or you're having any chest pain, my suggestion is you call Dr. Plato at 954-739-2273. Fantastic young man with a brilliant education. So, Doc, you're also servicing the hospitals you're servicing right now is Florida Medical Center, Delray Community, and also North Shore. Am I correct?
We don't do heart surgery at North Shore.
So you
Only
do,
heart surgery at Florida Medical Center and up at Delray.
and that's got a great heart lab too. That's got a great heart, basically for heart surgery.
Yeah.
Now, in your education, let me ask you a question. What are some of the things that they can avoid heart disease? What's some of the exercise or diet that they can avoid? What type of person normally gets heart disease? Is it basically hereditary?
Well, you're right. Genetics are a major factor. So people that have a family history, moms, dads, brothers, sisters that have had heart disease are at much higher risk for heart disease. Other things are diabetes and smoking. So the thing we tell people, the most important thing is to stop smoking. That will help reduce your risk significantly.
Well, a lot of these people now are taking vaping now, this thing called vaping. Could that be a contributor to heart disease too?
We don't know the answer to that yet. So it's just too new of a technology to have seen the kind of long-term effects of it.
So what is if I said, okay, I'm on the fringe of a heart disease, what are some of the things I can do to probably avoid it, avoid surgery?
Yeah.
Is
Well,
a
that's
diet
a great
important?
It's really important. So a low-fat, low-cholesterol, heart-healthy diet is really important. And the other thing is moderate intensity exercise for 30 to 45 minutes a day, about 5 times a week.
Hear that, folks? 30 to 45 minutes a day. That doesn't mean you have to go up and lift those 300-pound weights. Walking would be sufficient. Jogging a little bit, swimming. I'm sure all those things would be good. And what you put in your system is extremely important, how your heart and your body's going to react. So that means, what the doc is saying, I guess what you're saying, Doc, is go to a low-carb diet and watch your cholesterol.
That's right.
So, you've been doing this for a while now, cardiothoracic surgery. What are the things that you suggest you look out for? What would a person look out for if he's at home and he's not feeling well and he really doesn't know? A lot of people now are Googling their ailments, and they don't think it's serious. They just Google it. So you're saying to them, if you have chest pains or pains in your arm or anything that might you think related to cardiac problems, to give you a call to make sure that, would they call you first or call a cardiologist first?
Yeah, probably call their cardiologist or their primary care doc first.
Okay, so most of your referrals would come from cardiologists or family physicians, am I correct?
That's correct, yes.
Now, do you see a lot of people coming out of the emergency room? When they get into the emergency room with cardiac arrest, would they call on you?
Yeah, again, they typically go to the cardiologist first, even in that situation. But a lot of our patients do end up in the emergency room, and then kind of getting taken care of by the cardiologist once they discover the significant heart disease. We get involved. Yeah.
So what are the things? So my question to you, since you've been here in South Florida, you see we got a major elderly population. Does this disease affect at any age, or is it mainly seniors?
That's a good question. So coronary heart disease, so blockages of the arteries to the heart, does affect older patients more frequently. But we do see coronary disease in younger people too, as young as 40 and 50, but more frequent in older people. You're right.
It's amazing. I had a friend of mine who, if you looked at him, he ran, he exercised, he played golf, he played tennis, perfect shape. He didn't even have high cholesterol. His blood pressure was perfect. He ended up getting a bypass, a quadruple bypass. He was like 50-something years old. So this can affect anyone.
Yeah, it really can. And, we do say the risk factor of smoking, diabetes, genetics, but sometimes we see people with, none of those things, like your friend.
And how does obesity come into the situation?
Yeah, obesity is also, a problem, and that leads to worsening heart disease and kind of expedites the process. So it does play into the problem, yes.
So, Doc, when a person has this surgery, he's sent. Now, I had a friend of mine that had bypass surgery. They're sent now to a rehab center, usually at a hospital where they put them through a vigorous exercise program, especially for cardiac patients.
Yeah.
Is that the way it's done? It's not a typical physical therapy. It's basically they go through a whole program. Am I correct?
Yeah, that's really common, and I think there's pretty good evidence to show that that helps people in the long term. Helps them kind of maintain that level of activity that we know will help keep them heart healthy after their heart surgery. So that's something we try to send all of our patients to do after they have had heart surgery.
So when you perform this surgery, thoracic or whatever that may be, and the result is it's somewhat successful, or it is successful, is the life expectancy back to normal? I mean, are they expected to live a longer and healthier life or a normal life after that?
Yeah, most people will live a normal life. Most important things after heart surgery to make sure that happens are kind of modifying anything we can do to modify. So if that means weight loss or stopping smoking or kind of getting on the right track with medications, meaning taking the right kind of medicines to optimize your heart health, those things really do help focus in and get those patients to live a normal life after heart surgery.
Do they do any follow-up with you, or they go follow up with their cardiologist?
Oh yeah, after heart surgery, we'll see everybody just to make sure things are going smoothly after surgery and that they've recovered well. Once the patients are fully recovered, it's important that they follow up with their cardiologist and their primary care doctor. We don't see them long term, unless it's a problem with, maybe the aorta. That one we do tend to follow pretty closely, but most of the things we'll follow up with their cardiologist.
So your specialty, Doc, I mean, I don't have too many physicians that I see that have that specialty that you have. I mean, is that a sort of a rare specialty that there's very few cardiothoracic surgeons around?
Yeah, it's not the most common thing, that's for sure. Yeah, and the training is fairly long, so I think that a lot of people find other careers that they enjoy.
I was working with a group up in Jacksonville, and he was basically a surgeon, a cardiac surgeon that did infants. I mean, and that's a rarity too. Now, what age level do you do surgery on?
Any adult, so really anyone over the age of 18, I would operate on. Most of the problems that we see in those young people, up until you get again in the 40 or 50 range with adult heart problems, but a lot of the younger patients have had some congenital problem and are typically best served by someone like your friend who's specifically trained to do the congenital heart surgery.
Now, folks, did you hear what he said? I mean, people at 18 years old could have this disease as well as seniors. So again, we have this Dr. Plato. I mean, we're real lucky to have him in our South Florida area. And my suggestion is, if you feel as though you're talking to a cardiologist and he recommends that you have surgery, I recommend at least you get an opinion from Dr. Plato. His phone number is 954-739-2273. At least get a second opinion, a third opinion, a first opinion. Make sure you go talk to Dr. Plato, because with his specialty, that's the guy you want when you're getting cut up and your chest is being opened up. That's the man you want on your side, right? That's the guy I highly recommend with his background, and I can tell you I'm looking at him right now, he's a handsome young man. Doc, how old are you, may I ask you?
Yeah, 35.
35. At 35, so guess what? He knows it all because he knows all the up-to-date things. He's a young physician, and these are the gentlemen that have all the knowledge right now, what's new in the field. So at 35, God bless him, he's an amazing guy. Doc, we got to get off the air. I'd love to have you back. You're a fantastic guest. Thank you so much. And folks that you're out there, remember, All County Healthcare is there to serve you. Please stay healthy, wear a mask, social distance, get your vaccine shots when made available. Again, good night. Thanks a million.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. All County Healthcare, Inc. is locally owned and operated, serving the Tri-County area, Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 2009.